Privileged to talk to you this morning about sperm selection using the PICSI dish. I'm Dave Morroll, I'm Director of Clinical Support for CooperSurgical, and Aaron Lackmaker here is Clinical Application Scientist. He's going to show you the practical elements. Let's quickly go through some of the theory behind hyaluronan selection that underpins the PICSI dish. So if you don't know, the idea of the PICSI dish is it uses hyaluronan that's dried onto the bottom surface of the dish, and that's rehydrated, and the sperm are then selected when they bind to that hyaluronan. And what we know is that hyaluronan, of course, is the primary extracellular component of the cumulus complex. So sperm interact with hyaluronan at the early stages of fertilization. And what we also know is that ability to bind hyaluronan is acquired by the sperm quite late in their development. So they undergo spermiogenesis, and as they get to the point of peak maturity, they produce receptors to hyaluronan. So that hyaluronan binding is a good proxy marker for cellular maturity, reduced risk of aneuploidy, and high levels of chromatin integrity. And importantly, it also links to a risk of DNA fragmentation. So if a sperm binds to hyaluronan, it's very unlikely to be carrying DNA breaks. And we can see that from this beautiful study by Yagchi and colleagues. It's an old one now, it's 15 years old, but it demonstrates it really nicely. And what you can see here is they've taken a washed sperm sample and labeled the sperm with dyes. So a sperm with intact DNA will fluoresce green, and sperm that carry DNA breaks will fluoresce red. And we can look here, you can see the ring shape of the hyaluronan plaque on the PICSI dish. And it might not jump out to you, but there are next to no red fluorescing sperm within the ring. And when they did the assessment, you'll see here, the proportion of green sperm, the DNA-attacked sperm, that were binding to hyaluronan inside the ring was over 99%. In other words, if we select sperm that bind to hyaluronan on our PICSI dish, we have more than a 99% chance of that sperm being DNA intact. Does that make a difference? Well, we've heard, hopefully you've been here yesterday, you will have seen the Zymoc population and the importance of reduced DNA fragmentation. What we know from a big multi-center study done in the UK, this was up to almost 3,000 cycles of patients going through ESHRE who are randomized to standard ESHRE or ESHRE with PICSI selection. And what they demonstrated in an unselected population, remember, is that we couldn't see a significant uplift in live birth rate, but what we did see is a reduction in miscarriage. And this is really important because we know sperm DNA fragmentation, one of the principal issues around fragmented DNA in sperm is the increase in the risk of miscarriage to women receiving embryos that are created with DNA fragmented sperm. Now this study is really important. It's backed up by others, the Katie Warrilow study in the US across a number of US centers. But also what's interesting about this study is they went and collected samples and did a mechanistic analysis. And the mechanistic analysis enriched the data. There's a bit of modeling going on, and what they looked for, if you look down the y-axis, they looked at the chances of a pregnancy, so it depends on the woman becoming pregnant, the chance of the woman carrying to live birth when she becomes pregnant. And what you can see here, if you look at the red graph on the left-hand side, you see the age-related decrease in chances of live birth because of the increased miscarriage we see in older patients. But the really interesting finding from this mechanistic analysis was if you look at the PICSI chart, it's a horizontal line. So what the hyaluronan binding in the PICSI dish is doing is it's mitigating the risk of DNA damage that can't be repaired in older women's oocytes, which tend to be poorer quality, and maintains the likelihood of a live birth once they become pregnant. So they're more likely to carry to full term if they've had hyaluronan selection using the PICSI dish. So just to summarize all of that, we know that the integrity of sperm DNA impacts reproductive success. We know it's linked to miscarriage in particular. And this sperm selection with hyaluronan binding, for instance, with the PICSI dish, will mitigate the risk of DNA-damaged sperm and reduce the rate of miscarriage. And we know that's particularly important in women of advanced maternal age. So that's really important because they do not repair the sperm DNA breaks the way that good quality younger oocytes can do that. So it mitigates risk for all patients, but it's particularly older women that this will benefit. Okay, I think we can switch to the other screen if we can. Not that one. Ah, there we go. Okay. So what we can see, you can see a number of immotile sperm, but the ones that we need to pick out are things like, if I can find them. So if you can see where I'm pointing there, you can see a sperm that's bound by the head, and the tail is slowly rotating it because the hyaluronan binding is at the head, and the sperm remain motile, so it helicopters around. So that's the simple way you select sperm on a PICSI dish. So you can see a few of them are just swimming across because they're not binding. And you'll see these ones like this one, where bind to the head, helicopter around. And what you can do then when you're doing an ICSI case is you would bring your ICSI injection pipette down, give them a little nudge with a little negative aspiration, and the little nudge will lift them off the bottom of the dish. You aspirate, check morphology, and inject as normal. So it's a very easy technique to adopt. Okay, are there any questions? Yes?
Yes. I once read that you should use it not with a heated surface, but we're using it with a 37 degrees surface.
Okay.
Is this a disadvantage? Is it okay?
Okay, so the question was that whether you use the PICSI dish on a heated stage at 37 degrees or a cooler stage. One of the advantages of a cooler stage is simply that the sperm are slower, so when they impact the hyaluron on the dish, they're more likely to bind. If they're faster, they can hop a little bit. You can see them hopping along, but eventually they will bind. So that you can do it across a range of temperatures. The 37 is absolutely fine, and of course, in many cases, people want to do the PICSI and the ICSI in the same dish, so it's perfectly possible to do it 37. Okay, I'm going to end there, so thank you for your attention, and we look forward to seeing you later on the stand. Thank you very much.